During systole, the ventricles contract. This causes option A, all four heart valves to close, option B, all four heart valves to open, option C, the AV valve to close and the semilunar valves to open, option D, the AV valves to open and the semilunar valves to close. Answer is option C, the AV valves to close and the semilunar valves to open. During systole, the pressure is greater in the ventricles than in the atria, causing the AV valves to close. The pressure in the ventricle is also greater than the pressure in the aorta and pulmonary artery, forcing the semilunar valves to open. The normal pacemaker of the heart is option A, SA node, option B, AV node, option C, bundle of his, option D, ventricles. The answer is option A, SA node. Normally, the SA node is the heart's pacemaker, generating 60 to 100 impulses per minute. The AV node is the secondary pacemaker of the heart, generating 40 to 60 beats per minute. The layer of the heart responsible for the contraction is option A, myocardium, option B, pericardium, option C, endocardium, option D, epicardium. The answer is option A, myocardium. When grading arterial pulses, 1 plus grade indicates option A, bounding pulse, option B, increased pulse, option C, weak pulse, option D, absent pulse. The answer is option C, weak pulse. All pulses should be regular in rhythm and equal in strength. Pulses are graded on the following scale. 4 plus is bounding pulse, 3 plus is increased pulse, 2 plus is normal pulse, 1 plus is weak pulse and 0 is absent. When listening to heart sound, the nurse can best hear S1 at the option A, base of the heart, option B, apex of the heart, option C, aortic area, option D, second intercostal space to the right of the sternum. The answer is option B, apex of the heart. S1 is the best heard at apex of the heart and S2 is best heard at the base of the heart. When assessing a patient for jugular vein distension, the nurse should position the patient. Option A, sitting upright position. Option B, lying flat on his back. Option C, lying on his back with the head of the bed elevated 30 to 45 degrees. Option D, lying on his left side. The answer is option C, lying on his back with the head of bed elevated 30 to 45 degrees. Assessing jugular vein distension should be done when the patient is in semi-Fowler's position, that is, head of the bed elevated 30 to 45 degrees. If the patient lies flat, his veins will be more distended. If he sits upright, the veins will be flat. Normal capillary refill time is option A, less than 15 seconds, option B, 7 to 10 seconds, option C, 4 to 6 seconds, option D, 1 to 3 seconds. The answer is option D, 1 to 3 seconds. Capillary refill time that lasts longer than 3 seconds is considered as delayed and indicate decreased perfusion. A nurse is auscultating for heart sound in a 3-year-old girl and hear an S3 sound. The nurse assesses this sound to be option A normal finding, option B, a probable sign of heart failure, option C, a possible sign of atrial septal defect, option D, a probable sign of mitral stenosis. The answer is option A, normal finding. S3 is commonly heard in children. S3 also called ventricular gallop. When it occurs in adults, S3 may be cardinal sign of heart failure.